Welcome to the 2024 Perioperative Power List interview series. My name is Carissa Brewster, Editorial and Media Relations Manager for Whitman Partners. The Power List Award recognizes perioperative leaders and professionals who have been elevated to this complex role due to their business acumen, big picture thinking, and clinical foundation. Today we have Kat DeGeiso. Welcome, Kat.
Thank you.
You're welcome. Can you tell us your current role and facility?
So currently I am the System Director of Surgical Services for Northern Nevada Health System, which is part of UHS.
What types of new C-suite roles do you see developing within the next couple of years? So like Chief Transformation Officer, Chief AI Officer or AI Executive, Chief Data Officer. Yeah, what do you see coming?
Definitely along the lines of AI. I know there are a few positions out there, Chief Information Officer, you're seeing more of the CIOs. Data is a huge part. And I really feel like we're only as good as our data. And there right now in healthcare, there is this reliance on these systems. And I feel like a lot of them are antiquated too. We really have not engaged in some of the higher tech that's out there and available.
Yeah.
Like you look at, I think we're on the brink. I think we're starting to see that. And there are some companies out there that are, well, I'm seeing it you start looking through your LinkedIn, your socials, and you're like, wow, there's some really cool stuff out there. But it's getting, the healthcare systems to embrace them. And there's going to be a huge investment there. So yeah, I think we are really close to those pivotal roles with data and AI for sure. I also foresee, in some companies, they do, there are some that have embraced, I see a lot of vice president of surgical services roles in some of the larger health systems, even my own title. But really, surgery, it's kind of one of those things that you either fall under a chief nursing officer or you fall under a chief operating officer. And it's like, but you really report to all of them. And oftentimes these folks, depending on what their past experience was, if you're lucky to get a CNO who was an OR nurse at one point, they get it. But they struggle. They struggle with the financial needs that we have. The relationship building that you have to have with your surgeons. And I really do hope that there will be consideration for a chief that is over the procedural areas. I don't know what that's going to be called, but someone to focus on that too and take that up, because our rules are not the same as the rest of the hospital as it pertains to nursing. We don't worry about the quote, like heads in beds and the productivity that goes along with that. Ours is just, it's so different. And you're really lucky if you get an executive that understands your area. But that's where these roles, like the one that I'm in, you work so hard to feed them the information.
It's the challenge if you don't have that direct experience.
Right. Right. So, I mean, your CFOs kind of get it because, surgery, huge revenue generator for the hospital, or, but they don't understand, the regs that go along with it and the quality metrics that you need to meet. So you kind of report to all, and it just would be great if we had somebody at that level that just could oversee the whole thing in conjunction with the data, because your data is, if it's not right, you're certainly not sharing that with your surgeons, and you're certainly not sharing that with any investors or corporate higher ups that you have to report to. So for sure. I'm fascinated to see what AI is going to do.
Me too. I think it's I listen to a lot of podcasts, and I think the kind of conclusion a lot of people are coming to are that, AI isn't going to take your job. It's someone who knows AI that will take your job.
Well, and
So,
this area is like we've been seeing this coming. I mean, even with the
hmm
Da Vinci robot, and now they're
hmm
all the things that they're implementing into all of the robotics. So whether it's orthopedic, the spine, like all of it,
hmm
and they've been collecting that data. And this stuff is capable of doing a lot. And so I
hmm
think
hmm
we're going to see that first and foremost. I think
hmm
there are a lot of other
hmm
imaging probably, as well, but the procedural areas for sure
Yeah.
are
Yeah.
already chomping at the bit and looking to adopt this stuff. So,
Yeah. Yeah. It's exciting, scary, but like kind of exciting too.
yeah, I mean, I think if it's done right, and that's why it's so important that healthcare professionals like us are in with those companies too.
Yeah.
Like,
hmm
and like I said, that's probably the most fascinating thing watching through socials and through podcasts, things
hmm
like that. And I'm really hoping that they're going to engage nursing and techs,
hmm
all of these folks, to get in there and to actually set it up so that, I mean, there's so much that it could do for us, but not, like you said, I don't see it completely replacing us.
Yeah,
But,
for sure.
like, I just think about, I have a surgeon who has early onset Parkinson's.
Mm.
And, 10 years ago, prior to, the Da Vinci robotics, his career would have been done because of the
Oh,
tremors.
yeah.
Because of what we have with that, he's still able to operate.
That is incredible.
We are prolonging the longevity. We are the work that our surgeons are able to do. We're able to keep their expertise
hmm
um, with us. They're able to still see patients. They're still able to do so much. I mean, think about, healthcare or surgeons too. I've been seeing these great things that are like paraplegics, or they've lost some function, and yet we're able to create these things where they can stand, or it can
hmm
keep them up. Like, this
hmm
is
hmm
amazing, and this is what's going to allow for our healthcare providers to continue to provide care.
Yes, yes. So I love the example you gave with the surgeon. I'd never even thought about that.
Yeah, I mean, his career would have been done.
Yeah, yeah.
And why? Like,
Yeah,
his
yeah,
brain's still functioning fine,
yeah, yeah.
for
You
now.
wanna it really definitely helps of a organization to keep that organizational knowledge and
Hmm.
for an industry to keep that industry knowledge. So yeah, I mean, I think generally technology helps us. It's just, we got to manage it and we
Right,
have to not be afraid of it.
right.
Yeah. Yeah.
Use it for good.
Exactly. Yeah. Great way to end. I love that question. I love hearing what people say.
It's a good question. It really
Yeah.
is.
Yeah. Well, thank you for joining us today. I really appreciate you taking the time out.
No problem. Thank you.